This video is long overdue. This is a topic I feel very passionate about because a lot of times when I meet patients who've been dealing with this problem, they tend to have been dealing with it for many years and sometimes being misdiagnosed, sometimes getting the wrong treatment and still having the problem persist. A lot of patients get embarrassment from this condition, and I've even met a lot of women who don't want to have sex because of it, because especially in the bedroom it can cause a lot of problems. So let's get into it. So the medical term for a clitoris that is too big is clitoromegaly, and basically the criteria for this is that it's in many cases both too long, which is a very common complaint, and too wide as well. So typically when we measure what's visible of the clitoris, usually outside of the body we can see about a centimeter. In slimmer folks we may be able to see a little bit more, and typically the glands, or the little head of the clitoris, tends to be less than about 5 millimeters across. So patients who come to me with this condition, usually they'll be seeing me in their 20s, 30s, 40s. It's something they've been dealing with all their lives. But a very common thing they'll tell me is the embarrassment it causes in the bedroom, because a lot of time when they get aroused, the size of the clitoris can enlarge significantly, and this makes sense because the clitoris acts a lot like a penis. I always say the clitoris is anatomically just a penis without a urethra, without the part that you pee through. It's extremely similar, and it all develops from the same type of tissue. So it is on the underside of it full of erectile tissue, and so it's not uncommon the patients will explain to me that the clitoris will double in size or more when they have sex, and it can kind of poke out and seem like they're having erections. A lot of patients who come to me for this procedure, they've already been treated by a different plastic surgery with a labiaplasty. The vast majority of plastic surgeons in the United States are not trained to do a clitoris reduction. This is a much more complicated procedure, and instead they'll offer to reduce the labia or to reduce what's called the clitoral hood, which is the skin over the clitoris. In some patients this may work fine, but if clitoromegaly, or clitoris that's too big, is the problem, this is simply not going to work, and we need to do a slightly more complicated procedure known as a clitoral reduction. So first of all, why does this happen? The vast majority of patients I meet, this is just their anatomy. Genitalia come in all sorts of different shapes and sizes, and some people just are born and genetically programmed to have an enlarged clitoris. The next most common reason folks have it is because of prolonged steroid use, anabolic steroids. For example, I see it in bodybuilders sometimes, folks who've used testosterone. That can all increase the size of the clitoris. There are some reasons people can be born with this condition. Different genetic reasons, such as congenital adrenal hyperplasia. These are usually picked up in childhood, and most patients who see me have normal genetics, don't have these intersex conditions, and usually it's just what we call idiopathic. It's just a part of their anatomy. So what is the treatment for this? So just in and of itself, having an enlarged clitoris doesn't necessarily cause any problems. Of course, we only treat this if it causes the patient, but if it's bothersome to the patient, it causes them distress. And so typically in about half the cases I see, these patients have already undergone a labiaplasty elsewhere to try and reduce the tissue, to reduce the clitoral hood. And like I said, this doesn't cut it. They're still having that large clitoris. A lot of patients describe looks like a penis when they look down below. This is definitely true again in folks with lower BMIs, because they don't have much of a labia majora to hide it on the outside. So the procedure to reduce it, it usually takes me about 2.5 hours. Patients go to sleep completely from it. And so what we're going to do is we're going to make an incision just a little bit back on the clitoris itself where the glans is. We're going to leave a little bit of skin on the clitoris because we're going to put everything together again very naturally. And then we're going to lift the skin up off the clitoris. So we do this 360, and the next step of the process is we have to take that glans and the neurovascular bundle, or the super important pudendal nerves, the nerves to the clitoris. We're going to take those off the erectile tissue below. So this is why it takes me 2.5 hours, because we go really slow with this dissection. We do it under magnification. We're going to want to make sure that we get those nerves free and clear of the erectile tissue, and then we can trim back that erectile tissue. You do not need the erectile tissue in general in the clitoris, so we're able to get rid of it. And at this point, we just have our glans. In most patients, or the head of the clitoris that is, in most patients we'll reduce down the size of that because it's very common as part of their clitoromegaly, they have an enlarged glans as well. So typically we'll about half the size of that glans, if not more. And so next thing we're going to do is put everything back together as pretty as possible. And so typically that clitoris has been hanging down low, so usually we'll do a lift as well at the same time. We're going to tuck the clitoris back up into a more normal anatomic position. We're going to bring together the labia, and sometimes we have to trim the labia a little bit depending on what the patient has and what their preferences are to fit in with the new anatomy. We're going to pexy or lift that clitoral tissue into its new position and make sure everything is balanced and harmonious, and then we're going to do dissolvable stitches to put everything back together. Typically the downtime from this surgery is about a week. Usually I encourage folks to be about a week with us here in Miami. Most of the patients I do this surgery on fly in actually from all over the world because there aren't many surgeons that do this type of procedure. So typically we like you to be in Miami 5 to 7 days on average. I usually see folks back in the office a couple of days after surgery. There will always be swelling. I can never warn people enough about how much genitalia swell after we operate on them. So we're using ice packs, we're using things like ibuprofen to take down the swelling. Typically most girls can return to work the next week. Certain activities such as sex, usually we don't do that for about 4 weeks after surgery depending on the swelling. Certain workouts will be put off until after the 4 weeks as well. But overall recovery tends to go very well, and because we're separating that glans and the super important nerves from the erectile tissue below, we are not going to get that erection situation during sex again. So this procedure is an absolute game changer for patients who need it. There's not enough awareness about it out there, and unfortunately too many plastic surgeons are just offering labial reductions and clitoral hood reductions, I feel, when the problem is actually true clitoromegaly or clitoris that is too big. We're accepting patients for this procedure. Go to the link below in the comments section if you'd like a consult.